Hi everybody, and welcome to Rapping with the Rep. These are the COVID-19 series of shows that we're doing to update you on the changing conditions of our government in its reaction to the current health crisis. While we are not en masse at the State House, the building is closed and many of the non-essential workers are not there. Your representatives and senators, such as myself, are continuing to work from home and continuing to do what we can to improve the lives of our residents while at the same time addressing the health crisis that confronts us. What I'll be doing on a regular basis, if not daily, then every other day, is taping a series of updates from my home, because like you, I will be staying at home to the extent I possibly can. So from there, I'll be giving you information on the latest news, on the latest issues that we're confronting. I'm going to start off each time with a short 2-minute clip from the CDC to remind everyone what you should be doing in this time of crisis, how important it is to keep your social distance, to wash, etc. And then we'll be right back at the end of this 2-minute clip to talk about the latest developments. Thank you very much.
Hi, I'm Dr. Jay Butler, Deputy Director for Infectious Diseases at CDC. I'd like to talk to you about the new virus that causes the disease COVID-19. Older adults and people who have severe chronic medical conditions like heart, lung, or kidney disease or diabetes may be at higher risk for severe illness from COVID-19. If you are one of the people at increased risk for serious COVID-19 illness, it's especially important for you to take action to reduce the risk of getting COVID-19 now. The first thing you can do is take care of your own health. Wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer with at least 60% alcohol if soap and water are not available. Cover your coughs or sneezes with a tissue, or cough or sneeze into your elbow, not your hands. Avoid contact with people who are sick. Clean and disinfect surfaces in your home, such as counters, tabletops, and doorknobs to remove germs. Use household cleaning sprays or wipes according to the label instructions. The next thing you can do is make a plan for what to do if you do get sick. Know who will take care of you if your caregiver gets sick. Talk to your healthcare provider about getting extra necessary medications to have on hand. Get enough supplies too, including enough household items and groceries so you can stay home for a few weeks if you have to. The third thing you can do is pay attention to what's happening locally. If COVID-19 is spreading in your community, stay home as much as possible and avoid crowds. If you get sick with fever, cough, or shortness of breath, call your healthcare provider. If you develop warning signs, such as difficulty breathing, persistent pain or pressure in your chest, confusion, or blueness of the lips or face, these may be signs of serious illness. Call 911. For more information and the latest resources, please visit cdc.gov/COVID-19 or call 1-800-CDC-INFO. That's 1-800-232-4636.
Hi everybody, and welcome to an episode of Rapping with the Rep that's quite unique because we're living through quite unique times. The COVID-19 virus is affecting all of us. Today is March 23rd, and the governor has just issued an order closing non-essential businesses to public traffic. The businesses can remain open to the extent that they're not involved in person-to-person contact, but that's going to affect so many more businesses that were already under a strain when we were at the social distancing order. And it also is affecting us as a community. I've been so impressed with the attitude of our residents in the last week to 10 days since this has all befallen us, and that most people really understand why we have to take these measures. I've had very few people complain that we're overreacting or going too far in any way, and they're willing to do their part. But a lot of constituents have been talking to me about, well, can we do this a little different, or do we really need to do that? And again, understanding why we're all creating this sacrifice, we're all sacrificing for the common good. What I'm going to do with Rapping with the Rep now is turn it into an opportunity to communicate with you with updates from time to time as needed, but I'm thinking every other day, and this will be the last time that you'll see me with a full show from the Rapping with the Rep beautiful set that we have here, because I'll be working from my home office and doing sort of like a CNN kind of call-in. We may have another person, we may not. Today here in the studio, Jen Dodge has agreed very graciously to engage in a dialogue, because I'm just more comfortable with someone to talk to rather than just talking by myself. I'm still not used to that 8 years in as a government person, and so it's just easier for me. So Jen, thank you for doing that.
I'm happy to be here.
In the State House, while the building is closed, work is still going on. Today we passed a bill that will help the municipalities, including Burlington, which has a town election currently scheduled for the 4th of April 4th, right?
Right.
To be able to postpone that. And now it's up to Amy Warfield and the town now she will have the flexibility once it's signed by the governor, which I think will be signed today, in order to address whether Burlington will go forward with that. And I expect you'll have an announcement.
I expect we
Cindy.
will as well. I know
Yeah.
the town's already started looking into that. So.
Yeah, so probably within
Yeah.
a day, in fact,
Right.
there may be an announcement on that also. Really, largely the suggestion of a small number of town clerks, including Amy Warfield here in Burlington. We're looking into expanding the opportunities for people to vote absentee. Currently, the Constitution has three reasons that you could: is you're in the military, you can't be in town, or the third is that there's a disability or illness that you're suffering from. What we did was we worked toward defining disability and illness to include this. I can't
sense.
get out of my house
Right,
because
right.
of this illness, or I'm not comfortable getting out of my
Right.
house. And what I expect is we're going to see that either through an interpretation coming down from the Secretary of State, or through the bill if there was a change to put it in there. But one way or the other, I think that's likely to happen. But the big news from today was the governor's press conference, the governor's announcement that he's issued not a shelter-in-place order, but instead he's ordered that businesses are to close, non-essential businesses are to close for this person-to-person contact.
And I think there's a lot of questions with that. I know I was texting with a couple of my friends, and they're all like, what does that mean? And I know it's been outlined a little bit, but maybe that would be something that would be helpful for people.
Yeah. So first of all, I think it's important that it's not called shelter in place, because the last time we did shelter in place was when we had the marathon bomber. And that was shelter in place because there's someone out there that may be armed and dangerous. And this isn't, well, there is a virus out there that's dangerous, but we don't have that kind of a threat. And so therefore, the restaurants are still open for takeout. You can still go out and take a walk. You can walk the dog. You can walk your
Go
pet.
for a run.
You can still go for a run. That's right. You just have to stay 6 feet from each other when you do any of that, right? And businesses deemed essential, like the grocery store, the gas station, the pharmacy, but more than that, there's a list of about 100 or so businesses that keep us running, essentially so, that are still running. And there's a website that I think there's a cry on the back of the screen here that's going to, on the bottom of the screen here, that'll show you where you can go if you have a business that you think is essential for this Commonwealth in some way. You can apply to have your business deemed essential. So there's a large list of businesses that are exceptions.
Right. And how is that being regulated? Like, what if you're not sure if you're a construction worker, if you're putting a roof on somebody's house, things like this? Like, how do people know?
I think that first of all, in the short run, it's a matter of reasonable interpretation. If you're doing something that's listed, fine. If not, you could ask the question. If it's a close call, I mean, people should. There's a degree of judgment, and it's not going to be enforced in the beginning with anything more than a warning anyway. I mean, really, we're not in martial law, as was announced on the national scale today. So I think people shouldn't be afraid that
Right.
I'm going to do something and it's going to end up, I'm going to get a ticket or
Right.
end up with the police, knocking at my door. That
Right.
really want to, but if people absolutely ignore the spirit of what we're doing
Right.
here, and we've seen news reports from around the country showing that, gatherings in Florida at
Right,
the
I
beaches
know.
and spring break, right?
Unbelievable.
And that there was a study that just came out in Massachusetts, which is important, breaking down, maybe we'll show that as a graphic on this show, breaking down the age groups that this virus has
Right.
affected, because we have the positive test results.
Yep.
But the age groups are affecting the younger groups of people
Right.
just as much as the older groups.
Right.
And I think many people think that if you're young, you're immune to it.
Yep.
And that's not true.
Right.
If you're young, you can still get it and
Yeah.
will, and it's a very nasty
Right.
virus. I mean, yeah, it's a virus that will kill. I think
Right.
the statistic is 3% of those who receive it, and it's true that the older people are more susceptible to that
Right.
severe outcome.
Yeah.
But even a younger person who gets it, and people are
Right.
probably watching TV, it's a really, really uncomfortable, and that's a euphemism.
Right.
We say uncomfortable. It's a really painful virus
Yeah.
to get. So you really don't want to risk it. It's not just that you can then pass it on to your grandparents, and I've heard that a lot from
Yep.
people being interviewed. That's true. But you'll be bedridden if you just
Right.
ignore what's going on.
Right.
And what's going on is that this is very, very contagious.
So on the economic front, I also know that you've been working hard to file unemployment relief
Yeah.
for people who are going through this tough times and have lost their jobs, whether they're working in restaurants or other non-essential businesses.
Jen, that's a really important topic, and I'm really glad that you brought it up, because we're going to see more and more people who are going to lose their jobs as a result of this situation and rely on unemployment and other forms of substitute replacement wages in order to get by. The way that unemployment works is that the employers pay into an unemployment system through on the taxes when they do their paycheck. We do that, and what we're responsible to do as a state is build that trust, the unemployment trust fund, and within it we build a cushion. We have a reservoir, and Massachusetts is solvent. So that's to say we have money for this rainy day within the fund, right? But this rainy day is a monsoon. I mean, really it is.
Right.
And so the federal government realizes, first of all, there are other states that aren't in the same position that we are, and they're going to really have to bail them out.
Right.
This happened in 2008, where the
Okay.
federal government
Yeah.
had to give loans to many states in order to do that. So in and of itself, there's going to be a strain on unemployment. And on top of that, we're going to have to look at ways that we can provide unemployment benefits to people that aren't traditionally covered under the system, like, say, writers, artists, people that we
Right.
call 1099. They're the freelancers. They're out of work as well. So they're going to have to come into the system. So we're going to have to really be looking hard and quickly to how we're going to
Yeah.
reform this system. Many constituents said we've got to cover this, that, and the other, and we do. And
Right.
we do. There's no two ways about it. We do.
Right.
But it's not as easy as just extend benefits without identifying how we're going to fund the extension of those benefits. We have a finite amount of money right now
Right.
to go along, so we may need to put more into it. The other thing I've been really concerned about is that since schools have been closed, we have parents who haven't been able to go to work.
Right.
Schools and daycares are closed. So
Right.
parents who maybe didn't lose their jobs but couldn't go because there's no one to watch their children,
Right.
right? I was, many of you know, I filed the paid family and medical leave bill that was passed into law last year. That starts in January of 2021. This really wouldn't be an incident of coverage, because that really looks at kids who are homesick,
Right.
people like that. It's not really the kids who are home because of a crisis like this. But
Right.
if it was funded, so first of all, it's not funded yet, because the theory is that people have been paying through their taxes so that we can build up solvency. It's not
Right.
there yet.
Right.
But maybe we can put a deposit, maybe. I'm not speaking for what's going to ultimately happen, but the
Right.
ideas are maybe
Right.
we put some money into that system and then add a benefit. But we're going to have to help parents
Right.
who lost their jobs, who gave up their jobs.
Right.
We're going to have to look at the definition of, in unemployment, normally you don't get unemployment if you voluntarily resign. Well, there are some instances where you were forced to resign because, for
Right.
example, your kids are at home.
Right.
So that's something
Right.
that we're looking at, all those wage replacement issues. Also, we're looking at, continuing to look at how we're going to help small businesses that were ordered closed.
Right.
They had no choice. The governor said you have to do your part. After today, there will be many more businesses that will be forced to shut down.
Right.
Where do they turn?
Right.
No, the governor's not responsible because he's protecting our health. That's true. Again, I'm still impressed with how few businesses say, you shut me down. That's not happening. They're saying, I was shut down, but I need help. The Small Business Administration put up I think it was $10 million at first in a loan program. That got taken overnight. So we've put more money into that. And what we've got to do is provide not really loans, because imagine a business is not in, you have no revenue.
Right.
Now all of a sudden you're up and running. It'll come in somewhat slowly because people don't have money when we first come out of this, right? And so you have to run your business, pay your staff, buy materials, and repay a loan.
Right.
I mean, that won't work.
And there's been some sort of lease relief,
Yes.
So you want to talk about that?
Thank you for being here again, Jen. Thank you. There's so many issues,
There's
much
so
is
many,
affected.
Yes, so many.
So so the issue is, so you've got people who own rental properties, right? People who are renting to other people, and their strategy is, I'll get some income, I'll pay my mortgage, I'll collect the rent pays the mortgage, and then some, right?
Right.
Now people can't pay their rent.
Right.
And so those other people can't pay their mortgage. Or, I can't pay my mortgage, it's the house I live in.
Right.
All of those things. And if we do nothing, we're going to see another crash of the housing market. Right? So on the state level, we're working toward some support on the back end, which is to say, we've got to have people have a moratorium on payments, but the banks can't, I don't know that they're willing to carry it all on their own. And we're not in a country that we can order a particular industry to say you're going to operate without profit.
Right.
There are governments that can do that. Ours isn't one of them.
Right.
But we can work with industries to reach resolutions to do that.
To alleviate the least economic downfall that could occur, hopefully.
So as you can hear from these, as the answers, these are complex issues.
Right.
They're not simple answers to these issues, but they're solvable.
Right, and you're working to solve them, and they'll be in the future Rappin' with the Reps that people can tune into.
They will.
Right.
If they were easy, anybody could do it, really.
Right.
But what people here should know is we're working on it.
Yeah.
And going back to the Charlie Baker press conference, we work together on it.
Right.
They don't have to worry that something's not going to happen because of a political fight.
Right.
We're working to get the best ideas on the table, and then to cooperatively reach a position where we can help.
What about people traveling, people who have loved ones, snowbirds, people who are down in Florida and they want their family members back up north, things like that?
This is a very difficult time to do that. And so you've got to really, there are some emergency situations where someone's got, for example, a child in school, and the school is closing and they've got to get there. Okay, that's an emergency situation, and no one will be faulted for that. But we're in a situation where people are asked to stay home. Going out when necessary. You're not a prisoner in your home or trapped in your home. That's not the case. But the theory behind this is to slow down the movement of people.
I agree.
And I'm hearing from people in northern New Hampshire, northern Vermont. We have relatives there. That there are people from Massachusetts anticipating these orders coming up there. Right. Well,
you don't want to do that. You bring it up.
You bring it up because of the lack of testing. We can talk about that too, but because of the slow, we're catching up. The testing is being expedited, but because there are many people who are carrying this virus who don't know they are, that's going to bring it to other places. So the more travel, the greater the spread. And that's how it's all exploded.
Right, but as of right now, there's not a ban on travel. Is that correct? I think other states there are. I think there's a couple, right?
Yeah, well, I can only speak for our state now.
Right.
But there's no ban.
Right.
There's no ban.
Right.
I wouldn't advise you to do it.
But we want to be safe, and we want people not traveling as much as possible.
And you've seen this because of today's order following about 4 days on the heels of the stricter order from the governor when he talked about social distancing, when he always says, as of now. We don't know where we're headed, and this isn't a warning or a threat or anything like that. It's just that we've seen this pattern that we're going to try the least restrictive means of containing this virus. But if it becomes necessary to get more restrictive, as they have in New York and California, the most important thing is to keep our residents safe.
Right.
And the best way that we have of keeping these restrictions at a more manageable level is to comply and to do as little movement as possible, right?
I think it's so important because
And so from the point of view of our residents, that would mean, refraining trips to go out to certain places, but at the same time, there's a balance. So again, take a walk, take a run, do these things, but remember to come back and don't unnecessarily congregate to go to the beach or something like that.
Right, it's very frustrating seeing that happening, knowing that these businesses are being closed and people are being impacted so drastically to keep people safe and to see people ignoring that and doing large gatherings.
And from the point of view of the businesses, I'm on the Economic Development Committee. I'm vice chair, and we meet. In fact, we met today virtually for about an hour, and we'll meet again in 2 days. So we're meeting twice a week now to discuss. And one of the things we're seeing from the businesses, I'm not talking about Burlington or Bedford necessarily, but where people come into the business, be it a grocery store or other store, and immediately congregate.
Right.
And that's going to be a problem. That is a problem, and will continue to be a problem. And so, I was at True North over the weekend, and I saw how we in fact, Jen, you and I just talked about this, but off camera, but Paula has created these series of squares and tell people you've got to be in a square and advance up the line by going pre-measured square to square.
I think
that's tremendous.
Yeah,
it's a
really
great example of what our businesses can do to say this is the important thing, and we'll make it easy for you. Stand in here. Because there's a responsibility there too.
Absolutely.
I was in Wegmans and they staged a line that went around the store, and it was actually efficient. It was a little bit intimidating because the line went so far around.
Right, but it's spread out, right?
But because when you get to the end, they then assign you to which like a teller, which checkout is open. It actually goes kind of fast.
Right.
But that's the forward thinking that we need from that community, from the business community. Because they're still open, and we need them. We certainly need the grocery stores. We need the convenience stores, to stay open. And we need the restaurants to stay open. And so when you have 4 or 5 people waiting for takeout, to make sure they're spread apart is important.
Right. So I'll ask you a question, not to put you on the spot, but I actually got takeout yesterday, and I came out of the store, and his guy in his car said, "How do you know it's safe?"
Yeah.
So I don't know if you want to speak to that.
Well, there's no foolproof formula for anything. And so when you're in the supermarket, I'm not picking on anyone, but there's a degree of risk to everything that we do in life. And so right now, we've got to remain careful. Now, the food is cooked. I assume that we're talking about. So.
I think that's an important thing.
Right.
Because that's what one of my friends said is, don't get sushi, don't get, some uncooked foods, get cooked foods. It's a little safer.
Yeah, that makes sense.
Yeah.
I think that makes sense. So that's one protection that we have. But yeah, I mean, when we come home from the market, I guess we've got to be more careful to make sure that our fruits and our vegetables are washed.
Yep.
Because it's not just the employees of a business that go near them, but it's the customers that go near them. And how are we gonna tell people not to pick things up?
Right.
They do that.
Right.
And
so washing and temperature control, things like that.
Yeah. But yeah, we can't bubble wrap everything. We're trying.
Right.
But that's a good point, and it's been raised. So so those are important things. So with the governor's order, again, there's a list that you can go on the website. You can go on our website too, and I think that BCAT has a link eventually to get to it too.
We do. We have a list as well.
So you can see now what will remain open.
Yep.
The restaurants, again, I think I said this earlier, still we can do the takeout.
Yep.
Still, the liquor stores are still open. I filed a bill today that would allow the restaurants to be able to sell beer, wine, or a spirit in a container to go because they've got inventory that they can't do anything with. And so, you'll still be able to go to a liquor store and a restaurant. That's true, but maybe some people want one-stop shopping, or some people that call a restaurant for delivery. The liquor stores aren't delivering, to my
No,
knowledge.
I know. I think that's fantastic.
So they'll be able to do that. It'll
Right.
help the restaurants a little bit,
Right.
you know, and
Yeah.
we have no monopoly on ideas
Right.
in the State House or, you know, here in Burlington too. And so if anybody thinks of anything that could be helpful,
Right.
but these are the things that we can do together.
No, I'm really impressed to see all the quick actions of the legislature actually.
Thank you. You know what?
No,
And
it's
you raise a good point. I'm really glad you're here to have this dialogue, because you know, when you go from hearing, I don't mean to sound political, but when we go
No.
from hearing press conferences that come out
Right.
of the White House and then out of Beacon Hill, and we hear Governor Baker, and we may disagree on certain policy
Sure.
things, we're supposed to. That's democracy.
Right.
But when we hear him sharing his thought process
Yep.
and explaining why we're doing what we're doing, knowing that certainly there are certain people who are temporarily out of work as a result of what he's saying, but he's put thought behind it, and and so when he talks to the media, when he gets questions, he's respectful of those questions. He understands why the media
Right.
is curious about things,
Right.
you know, and some of the questions are some that he wants to answer, and some are those he doesn't want to answer
Right.
because he knows that the answer is disappointing,
Right.
because that's the situation we're in.
Right.
But it's all respectful,
Right.
and it understands that we're all in this together,
Right.
the media as well as the government.
Right.
And I'm really impressed and proud, actually,
Right.
when I see that press conference coming at the heels of a different one with a different tenor.
Right.
And when he just says, okay, boom, 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 this is
Right.
what we've got to do.
Yeah.
And someone says, but I think we should be more severe, you know, and then we need to take the next step. And he says, we'll consider that, but at this time, this is where we need to be.
Right.
Okay. And then in the case of the closing the person-to-person businesses that we did today, he said no to that a few days ago. Today, after the weekend, you know, maybe he observed that things weren't going as he had hoped. He changed, so he's not there to say, well, I've got to make sure I was right.
Right.
He's
Right.
more there saying, I got to make sure I'm protecting
Right.
this Commonwealth and the people in it.
Right. And to your point earlier, if people just really heed all the advice that's being sent out there, and we really do our social distance, and people are being disciplined and not traveling around, I think it really will work
Yeah.
in minimizing the
Yeah.
spread.
Now, before we went on the air, you mentioned sort of the third leg of this stool, which is
Right.
healthcare.
Right.
The reason that we're going through this, we can look at Italy as an example
Yeah.
of what's happened when you're a little bit less restrictive. We also can look at, by the way, some other countries like South Korea that had a lot of testing that was
Right.
more
Was able to
restrictive.
contain.
But with that, it's a balance. And so
Right.
the more you do to contain this virus, the more civil rights you
Right.
interfere with.
Correct. Yeah.
And you know, the more that you interfere with the economy.
Right. Right.
And so we've got to, you know, really our health, staying alive is more important.
Right.
That's the most important thing. But there's all these levers that have to be considered.
Right, yeah, like we talked about, first it is sort of like your civil rights, and you sort of being able to sort of live your life as American that we're used to, and then it's considering the severe economic impact that it's having on so many people, and then everybody's going to be, like I said, a couple weeks down the line, everybody's going to be concerned about, everybody's going to know somebody who has it.
Yeah.
And be dealing with that rather than that they lost their job or this or that.
Yeah, I mean, we have in this area, Burlington, Bedford area, we're fortunate. We have a number of wonderful healthcare facilities.
Right.
But we have a
Really are.
finite number of beds.
Right.
However that may be, it's a finite number. And we already care for a number of people who have conditions like
Right.
heart attacks and
Yeah.
cancer and the things that we
Right.
already have. And now you're going to add to that people who are suffering from this virus. And so
Right.
the issue is the strain. If we get a vastly large number of people suffering from this virus all at the same time,
Right.
then the strain on our for beds in the healthcare system, the strain for ventilators and the rest of the equipment is going to overwhelm us, and people aren't going to be able to receive the care that they have to have. And
Right.
so that's one of the important reasons why we have to go through this, to spread
Right.
that out so everyone doesn't show up at the hospital
know.
all at the same time.
Right.
Right?
Right.
And the other problem that we're addressing, but we have, is the shortage currently
I
of
know.
personal protective equipment. They
For
call
the
it
healthcare
PPE
workers.
for the healthcare
Yeah,
workers
it's
and the
horrible.
first responders.
Right.
decisions are being made there too. You know, here, but in other places, primarily, you know, in California, New York, more so. But
Right.
but things are happening here. You know, things are coming if we don't address it.
Right. No, I've heard there are different sites or places where you can donate. I hear if you have masks or things like that, people can donate.
They can, and I know Leahy is participating in a program for
Right.
that, so people can go there. I know that AFC Urgent Care is really heavily involved in this process.
Nice.
Dave Adams, who has the
Yeah.
facility here in Burlington and the one in
Yep.
Bedford, has one in Waltham as well. And in Waltham, they're starting a drive-through testing
Nice.
opportunity for people who need the test, get
Right.
an appointment to get the test. More people should have access to testing,
Right.
both for their own benefit, but also the rest of us, because the sooner that we know that someone is testing positive, the sooner we can put them into, you know, a self-quarantine situation that
Right.
protects everybody.
So those sites are collecting masks?
Yeah,
Okay.
yeah.
Nice.
So you can do that.
Right.
And you know, and there are ways to do your part in that way, and
Right.
that's important too.
It is.
Not that anyone can obtain these as individuals, but the
Sure.
nasal swabs that are used to collect the samples to do the test are in tremendous demand. We don't have enough of them, and so you may know this, but normally when our child has a sore throat, they go to the pediatrician and they get a nasal swab to see if they
Right.
have strep. They're not doing that right now because
They're
those
collecting
swabs
them?
are too valuable.
Right.
Right, they're reserved for people who are
Wow.
suffering from this. And so one thing that we've done is we've reached out to the life sciences community. We have a very vibrant life sciences
Yeah,
community here
we
in
do.
Burlington. And so Mass Life Sciences has been asking, well, really the business have volunteered anyway, but they're donating their lab equipment to the hospitals now because they can right now be better used to treat people rather than engage in the research for
Right.
future advances in medical
Right.
and treatments, which is vitally important,
Right.
but it's all hands on deck.
Right. Right.
And so this is really, it's just
It's a
far
unique
reaching.
time.
You need time and
Yeah.
you need equipment and we need to some
Mm-hmm.
extent play catch up to all the things that we need to be able to have in order to
Right.
confront this and treat people and diagnose people.
Right.
And as we've been saying, the way that we have that's most available to us is to separate people,
Right.
to spread. It's not going to cure the COVID-19 virus.
Right.
It's just going to
Slow it down.
frustrate that virus
Right.
so that it can't travel from person to person
Right.
if there are fewer people to contact,
Right.
for it to contact.
Right.
So BCAT's doing a tremendous service.
Well, thank you.
I hope all of you are subscribing to Rich Hosford's newsletter. I mean, everybody in Burlington should be doing
BCAT's
that.
newsletter.
BCAT's, I'm sorry. That Rich
Yeah.
Hosford, right. You're absolutely right. Because that Rich does, it's just
Yeah.
a tremendous source of information for people here in town.
Right,
And
right.
he already had the governor's announcement, I noticed,
Yeah.
in an email
Yeah.
already came
Yeah.
out, and he'll have it again in the morning.
Right.
And you'll be running these updates, and you're running updates from the town as well.
Right. We're trying.
Yeah, I mean,
Yeah.
the town is tremendous. Obviously, the schools are affected by it. They're closed down until the
Right.
7th.
Right.
Of course, everybody knows that that doesn't mean that they'll reopen the day after that. It could.
Right. We don't know.
We don't know.
Right.
We don't know. And other town services like the election are affected by it. And so you've been doing a great job keeping people informed of things that involve this town. This whole BCAT itself, you know, some communities, not right around here, not in Bedford or Burlington or Wilmington, but some communities would see the opportunity to have a cable access network like yours as something they don't value. But
Right.
here in Burlington, the community values it, and you've done a tremendous job with that support.
Well, the whole community on a whole has impressed me. The community of Burlington, seeing every person, whether it's, you know, Rick Parker from the chamber, or Amy Warfield from the town hall, or, you know, the superintendent here, and
Yeah.
Paul Segarino, every person has really pulled together in just such an incredible way. And although there's all this distancing, everybody's been in contact and really supporting each other. And I think that Burlington is a strong community, and it's just made me feel really proud or happy to be a part of the community.
Yeah, there's a lot
Yeah.
of support here.
Yeah.
By the way, we also sent through a bill that'll probably go through this week dealing with town meeting, allowing the moderators to be able to postpone town meeting.
Right.
And again, that's an important way that this town and others govern.
Right. Right.
And we can't congregate in the way that we would, even if we were to rope off probably every 9th seat. When you think about the 6 feet, you wouldn't get
Right.
you wouldn't get the members in. I don't
Right.
think.
No, it's true.
Thank you, Jen. Thank you very
Yes.
much for coming on Rapping with the Rep. This is great to have you as a guest.
you.
It's wonderful. Folks, thank you for tuning in, and we'll be back shortly with updates. I'm Representative Ken Gordon. Thank you for tuning in to Rapping with the Rep.